A refund program is basically an opportunity for patients to have money returned to them if they're unable to achieve a successful pregnancy. It started probably 10 or 15 years ago in a program on the East Coast. And it was initially called a shared risk program. So the program was sharing some of the risk as well as the patient. And they had to meet certain criteria. And if they met those criteria, then they were accepted into the program. And in this particular program, the shared risk, they were given a partial refund. It wasn't a 100% refund. Premier IVF, on the other hand, provides a 100% refund for the patient. So if they don't achieve a live birth at the end of their treatment cycles, they do get all their money back. And those treatment cycles include 3 fresh cycles and 3 frozen cycles of IVF. So it gives them multiple opportunities to achieve successful outcome, i.e. live birth. We do realize that IVF is a very expensive form of treatment for our infertility patients, and it's been slow change. Initially, I would say almost every part of the country, they had to pay out of pocket for these services. Currently, there are 15 states in the country that have mandated laws to cover infertility. Now, there are some loopholes in these laws, but these 15 states, a lot of the patients do have coverage for IVF. For those who don't, there's really no other options available, and it is a large investment to invest in this treatment. And by having these programs, these shared risk programs and refund programs, it enables the patients an opportunity to achieve their goal of having a baby and not necessarily have no end in sight, meaning that either they have success, a baby, or at the end of the day, they have not lost any money from that attempt. In the past, they could have spent, $10, $20, $50,000 and end up with no baby in the end and be financially depleted and have no other options. And other options for these patients would be adoption or egg donation or other forms of fertility treatment. The ideal patient for that refund program is someone who does not have any other coverage for infertility services such as IVF or ultrasounds or blood work. So basically they're paying out of pocket for all of their services. The qualifications for most refund programs are multiple. Age is one of those factors, and different programs have different age cutoffs. For example, ours is around 40. Other programs will look at FSH levels. So FSH levels have to be in reasonable levels, 10 for example, for a lot of refund programs. And another hormone level, which is relatively new, called anti-Mullerian hormone, is also checked, and that has to be above 1.2, depending on what assay is used. Other qualifications would be, have they failed multiple attempts? A lot of times if they failed multiple attempts at other programs, they would not qualify for a refund program. But most have accepted at least one failure outside of our refund program. Certainly going through IVF treatment can be extremely overwhelming for patients. My wife and I went through 5 IVF cycles ourselves, and certainly the finances definitely play a part in that, no matter what your income level is. And I think these Premier IVF programs and other shared risk programs offer an opportunity for couples to at least take that financial burden off of them.